Hello guys, today we are in unit 3rd, that is assessment and management of pregnancy in antenatal period. Antenatal period in the sense period of pregnancy before delivery, that is antenatal. And 3rd unit, 4th unit combined we get 17 marks. One question for 10 marks, one question for 5 marks and one question for 2 marks. If you complete 3rd and 4th unit, you will get 17 marks. What is normal pregnancy or pregnancy? It is a state of dynamic physiological adaptation to meet the demand of a developing fetus, childbirth and lactation. See, pregnancy is a stage or the state in which the woman undergoes changes in dynamic way. Dynamic way in the sense in all the factors like physically, mentally, emotionally, in all the way she undergoes changes, that is dynamic. And physiological adaptation. Physiological adaptation in the sense physical changes. During pregnancy, women's body is changed. That is physical adaptation to meet, why her body is changing? To meet the demands of what? Developing fetus, childbirth and lactation. Fetus is grown in her womb, so her stomach is enlarged. Childbirth, her birth canal is also enlarged. And lactation, even her breast is also grown a bit. These changes are generally seen in the pregnant women, and this is known as normal pregnancy or pregnancy. This pregnancy period is around 9 months. In other way, it is 40 weeks. If the baby is born at the end of the 9th month, then the baby is considered to be full-term baby. If the baby is born before 9 months, that is around 7th month, in the mid of the 7th and the 8th month, if the baby is born before the 9 months, then the baby is considered to be the preterm baby. Now, this pregnancy is actually divided into 3 stages or 3 phases based on the trimesters. There are 3 trimesters. First trimesters, second trimesters and third trimesters. In first trimester, considers the period from conception to 12th week. From the conception, that is from the pregnancy to the 12th week, it is considered to be first phase or first trimester. And from the 13th week to the 28th week, it is considered second trimester. From the 29th week and to the delivery or 40 week, it is considered to be third trimester. Now let's see what are the physiological changes during pregnancy. Physiological changes in the sense physical changes. Physical changes are seen in these sectors, that is reproductive system, cardiovascular system, blood volume, respiratory tract, urinary system, GI system, skin change, endocrine system, psychological system. These are the changes seen, and let's see this in the brief way. The first system is reproductive system. In that, the first is uterus. Changes occurs in uterus during pregnancy. First, the weight of the uterus is 50 grams, but during the pregnancy from 15 grams it becomes 1000 grams. That is, the weight of the uterus is increased 20 times from the normal value because it is bearing the baby. Next, the volume. The volume of the uterus is around 5 liters because it carries the baby and the amniotic fluid, so the volume of the uterus is around 5 liters. Next, the shape of the uterus. At the very beginning stage, the uterus shape is like this. This is elongated, and from elongated it becomes a bit oval. That is around 2 months it becomes oval, and at the mid gestation, that is around 5th and 6th month, it becomes round, and again it becomes oval, and again to the elongated shape. Next, the muscle layer of the uterus. The uterus has 3 muscles, that is the outer layer is known as longitude layer, the middle layer is known as vascular layer, the inner layer is known as circular layer, and these layers undergo hypoplasia and hypertrophy, that is increasing in number of cells, increasing in the size of the cell. Next, it's very important, the length, breadth and thickness of the uterus. The length of the uterus is normally 7.5 centimeter, but it increases to 35 centimeter. The breadth of the uterus is normally 5 centimeter, it increases to 22.5 centimeter. The thickness of the uterus is normally 2.5 centimeter, but it increases to 20 centimeter. These are the changes that is occurred in the uterus during pregnancy. Next is cervix. In cervix, the common sign is Goodell sign. This is nothing but the softening of the cervix. The cervix is the way where the baby passes out. So this way is softened than the normal thing. Next, the length. The length is doubled. Than the normal length, it is doubled. Next, we have vagina. In vagina, the common sign is Chadwick sign. Chadwick sign is nothing but pink, purple, blue discoloration. Either pink or purple blue color is discolored around the vagina. That is Chadwick sign. And next, the secretion which is seen in the vagina is more acidic than the normal. Next, ovaries and fallopian tube. In fallopian tube, we can see hypertropia, that is increase in the size. This normal cells, but at this condition, the cells become like this. This is the normal shape of the cell, but at this condition, at the time of pregnancy, the fallopian tubes becomes, cells gets enlarged. And next, ovaries. There is no ovulation, no menstruation at the time of pregnancies. It is because of the, mainly this one, increased level of estrogen and progesterone. Due to the FSH hormone will be active. Because of this FSH hormone, there is increased in estrogen and progesterone. If this both hormones are in increased level, menstruation doesn't occur. If suddenly this estrogen and progesterone level falls down, gets decreased, then menstruation occurs. Next, breast. Around 16th week, that is second trimesters, in the middle of the second trimesters, we can see the yellow color discolored around the breast. This is because of the colostrum. Colostrum is secreted. Because of that, there is yellowish color discolored around the breast. Montgomery tubercles. This is nothing but the pigmentation of areola. This Montgomery tubercles is known to be primary Montgomery tubercles at the first trimesters. That is from the conception to the 12th week. It is in the primary stage, primary Montgomery tubercles. After completing 12th week, that is from 13th week, this primary Montgomery tubercles starts getting developed and goes to the secondary Montgomery tubercles. This is nothing but the pigmentation of areola. Weight gained during pregnancy. During pregnancy, until 20 weeks, women will gain only 2 kgs. But after 20 weeks, women will start gain 500 grams per week. In short, per 2 weeks, she will gain 1 kg. At the end of the pregnancy, she will be gaining 12 kgs. For example, if the woman is 50 kgs, by the end of the pregnancy, she will be 62 kgs. Now, in which sector the weight is gained? There are 2 types. That is reproductive weight gain, net maternal weight gain. This is within the womb. This is outside the womb. In reproductive weight gain, the fetus which is in the uterus is around 3.3 kgs. The uterus itself 900 grams. The uterus is enlarged, so it is gaining weight. Within the uterus, we have placenta also, which is 600 grams. And liquor is nothing but amniotic fluid, which is 800 grams. And breast also gains weight, that is 400 grams. And outside the uterus, that is in the maternal body, in the mother body, the blood volume is increasing 1.3 kgs in the mother. It's because the blood is supplied to the baby. So the blood is produced more and the blood leads to weight gain, that is 1.3 kgs. Extracellular fluids. Other fluids also has been secreted in the body and that is also leading to 1.2 kgs. Fat and protein deposit is also seen and that leads to 3.5 kgs gaining in the mother's body. This all together leads to 12 kgs. This completes your reproductive system. I will provide questions at the end of the chapter. Until then, stay tuned.